Hi, you're on the Midwife's blog channel, and today we're going to talk about what hormone disruption is. In simple words, without fear or panic. Hormonal disruption is not a disease, but a condition where the hormones in your body are out of balance. Think of hormones as invisible conductors. They control our entire body, our sleep, appetite, mood, skin, menstrual cycle, and even weight. When there is a breakdown in this orchestra, the body starts to give signals, but often we just don't notice them or write them off as fatigue and stress. How do we know when something is wrong? We often write off symptoms as stress, fatigue, or age. But here's what hormonal imbalance can tell us: irregular or absent cycle, severe PMS, acne, oily skin, hair loss, fatigue, anxiety, abrupt weight gain or loss, insomnia, or sleepiness. Some people have one or two symptoms, others have almost all of them at once. The key is not to ignore them. Why is this happening? There can be many reasons for this. For example, chronic stress, lack of sleep, too strict diets, and exhausting workouts. Also, the failure can be temporary and natural, associated with adolescence, pregnancy, postpartum, or menopause. Sometimes problems are caused by thyroid, ovarian, or pituitary diseases. Therefore, you cannot diagnose yourself by yourself. Everything is very individual. What to do if you feel that something is wrong? First of all, do not panic and do not prescribe yourself drugs on the advice of the internet. The most sensible step is to see a doctor. He can prescribe tests for hormones, ultrasound, and also suggest what to do next. It's very useful to keep a diary of well-being and menstrual cycle. It helps both you and the doctor to understand what is happening. But even before you go to the doctor, you can already start taking care of yourself. Just follow a number of these simple rules. Sleep at least 7 to 8 hours. Try to reduce stress levels. Eat regular and balanced meals. Take frequent walks in the fresh air. Do not take medicines unknown to you without a doctor's permission. Avoid hard restrictions. Be gentler to yourself. And most importantly, listen to your body. It talks to you for a reason. Hormonal disruption is neither shameful nor scary. It's the body's way of saying, I'm having a hard time. Take care of me. And you have every right to hear that signal and respond. The main thing is to act in time and in the right way. If you care about body, health, and female nature, stay tuned. In the next video, we will talk about discharge, when it is normal and when you should be wary. See you soon.